good to have you with us on this edition of the Urban Debate. Viewers, let's put the focus one more time on the war against coronavirus in the big cities that are largely seeing COVID cases. A majority of the country's COVID cases actually come from these big cities. These are the big cities with a large population. These are the cities that also run the economic engine of our country, and so how they tackle coronavirus will really decide which way our battle is headed. And right now, we are making big, dangerous mistakes in these cities that could lead to a COVID disaster. From Delhi to Mumbai, even cities like Bengaluru that by far actually have been a good example of how to tackle the entire issue are witnessing brazen violations on ground. And I'm not just talking about areas where there has been unlocking. Even in containment zones, life just seems normal. And the idea behind highlighting all of this to you tonight is to remind you the citizen, that the coronavirus hasn't gone away, that the problem hasn't diminished in any way. Lockdown on paper in many ways may be over, but we haven't found a vaccine. We haven't found the solution or gotten rid of the coronavirus. Our healthcare system is still getting built up. There is a huge amount of burden on our healthcare professionals. Think about that and please take precautions. Do not take this situation lightly, or we will see area after area in the big cities, or cities after cities and districts going back into the lockdown like we have in few parts of Tamil Nadu right now, viewers. Here are the big violations that we have witnessed, and they are largely common around these big cities. Our reporters have been bringing us reports for past many days. One of the biggest violations is that even in containment zones where strict lockdown should happen, non-essential shops are also open. There is absolutely no social distancing in public places. Public places that have been opened, whether it's parks or whether it's market areas, on the streets where your mandis are, your street vendors are sitting, absolutely no concept of social distancing. We are not even seeing authorities or policemen on the road enough. Now, of course, for the cops, they have been tired and overly deployed in this battle for months together. But we have to find a solution to ensure there is implementation. No barricading in a few areas. That's what we saw in containment areas. Either the barricades were put, or there were some ropes and sticks that had been removed, moved away, broken down, or no barricading at all. Unrestricted vehicular movement. More than permitted passengers in autos and cabs. There is a defined number of people who are allowed in these vehicles so that the infection doesn't spread. But we just don't seem to care about it. Overcrowding at religious places, overcrowding at shops, people stepping out without masks. These are the basics. And yet, we seem to have forgotten them. So over the next 1 hour, I'm actually going to get you reports and raise some important questions for big cities like Mumbai, Bengaluru, and our national capital. And the question that I'm asking is, what is leading to this rampant violation? How has this take it easy approach really come? Basis what? Are we not seeing high number of cases still being reported every day? What is it that you and I are missing, or the authorities are actually missing? Let's begin with the city of Mumbai. Now, let me just tell you this. These are just the basic numbers. On June 8th, the city of Mumbai had 49,863 corona cases. By June 12th, they had gone up to 55,357. And as of now, there are over 67,000 cases that have been registered in the city of Mumbai. Mumbai actually hasn't even given a green light for many of the other relaxations that other cities have. The salons are not supposed to open here. Wine shops are not supposed to open here. Even the use of public transport is very, very limited for essential activities. But that's not what we are witnessing. And now new hotspot areas, new containment areas are coming up. So let me give you some of those examples. See for yourself, viewers. Watch this for yourself and think about what we are doing. How we may be headed towards a disaster if we don't take corrective steps right now. Indiranagar is a neighborhood in Mumbai's Mulund area. It has seen over 100 cases in just the last few days. Despite it being declared a containment zone, the area is neither barricaded nor are there any authorities that were visible to us when we did a ground check of this area. Residents were moving around freely despite lockdown norms. Here is a report.
Well, that's right. Mulund and Bhandup have now become the new hotspots here in the city of Mumbai. Mulund, where I am standing right now, has the highest growth rate at 3.7% against Mumbai's average growth rate, which stands at only about 1.88%. So you can see that how the area has seen significant jump in the number of COVID positive cases only in the past 1 week alone. In fact, I am here standing at Indira Nagar, which is one of the containment zone in the city of Mumbai. And as you can see, this particular containment zone, it has been contained only with, bamboos. No board as such of the containment zone has been put up here, as you can see. If we move a little bit closer to this particular location, it is very huge as far as the population density is concerned. It consists of buildings as well as slum pockets. And you can see that how people can be seen roaming very freely here in this particular locality, which is under a containment zone for the last 2 months, because this particular area has seen over and above 100 positive cases in the last 2 months alone. And as you can see, there has been no measures that have been followed by the citizens at all. If you move a little bit ahead, you can see that how these, snack counters are also open, which is obviously a violation. You can see that how people are standing here without wearing any mask, without maintaining any social distancing norms. You can see the food counters are open. This is a complete violation in a containment zone. Only medicine, like medical stores and milk stores is allowed to remain open. But here you can see that this is an entire violation. Even the hardware store is being opened as we speak. So, considering to all of these violations, Mulund and Bhandup, which have been once at the bottom of the list, have now, topped as far as the growth rate is concerned. And this is one of the concerning and alarming, for the BMC here in concern, because these are the new hotspots that now they have to deal with. So, since yesterday, they have started door-to-door survey and screening of people to find symptomatic patients, and mobile vans have also been deployed in several of the sensitive locations is what we understand, and swab test will be taken so that immediate treatment, immediate testing can be done. Specifically in such locations where the density of the population is extremely high, they are following the 1:20 ratio, where behind every positive patient, they will at least institutionally quarantine 15 to 20 specifically from the slum pockets. So this is how they plan to curb the infection, just like how they did in Dharavi, which has now seen a flatten, which has now seen a decrease in the number of cases. The similar method they are trying to adopt in these newer hotspot areas as well. With video journalist Tushar, this is Disha Shah reporting here from Mirana from Mumbai.
Well, that is one of the new fresh hotspots that have emerged in the city of Mumbai, Mulund. Now you can see why obviously it's become a fresh hotspot, because people forgot about COVID and stopped following the rules. Let me get you another example. Many parts of suburban North Mumbai have also become a big concern for the same reason. We also did a ground check in Malad, another of the suburbs which is now seeing a high number of cases. In fact, number of cases being registered here is far more than the average that the entire city is really looking at. Now we went to one of the marketplaces, which is a containment zone there, the Sombar Bazaar. It continues to be crowded all through the day, despite the fact that the area is barricaded and it is officially a containment zone. People were found making their way through tent sheets with no authority to monitor them at all. Take a look.
BMC is marking the problematic areas as containment zones and on paper giving orders that nobody will be allowed to enter or exit the containment zones if they are not associated with essential services. Non-essential commodities shops will not be allowed to remain open in the containment zones, and no vehicular movement will also take place. But the reality on ground is absolutely opposite of the BMC orders. This is Mumbai's Malad area, Somwar Bazaar in Malad, one of the containment zones, and it's not, and this area, of course, you can see in the name of ensuring that nobody comes out of the area or enters the area. Tin sheds are used here, but a gap is here, and using this gap, people are entering and exiting the area freely without any restriction. And there is no one from the authorities, neither from the local police nor from the BMC, to man the area to ensure that people do not violate the guidelines of the containment zone, and it clearly is not helping. Now, the entire purpose of marking the problematic areas as a containment zone is the areas which are marked as containment zones to contain the spread there. Lockdown is implemented in these areas so that the rest of the region do not have to go through the harsh guidelines of the lockdown, and only the problematic areas, the containment zones, are under that lockdown. But on ground, those containment areas, and it's not just Somwar Bazaar of Malad, many more parts of the region, of the city for that matter, are declared containment zones only on paper, and absolutely no implementation of any of the guidelines of a containment zone on ground is happening.
Well, you saw two reports, and this is just today. We've been getting such reports for the past few days. So let's try and understand what's going on and how do we address this problem. Joining us right now, Dr. LIPIKA Nanda, Vice President for Multi-Sectorial Planning in Public Health with PHFI, Dr. Om Srivastav, Director for Infectious Diseases at Jaslok Hospital and Research Center, and MAHESH TAPASE of the NCP. MAHESH, let me come to you first. In fact, today we also spoke with our State Health Minister, who said that if norms are not followed and people start flouting norms, we may even look at bringing lockdown in such areas. But why is this happening, and has it become a big concern for the government also?
Tanvi, first of all, allow me to thank you and the entire team of Mirror Now for making aware citizens that it is our duty to stay back at home and fight the pandemic. And we as citizens have also failed. There may be several instances where we have seen that the government must have failed in providing a certain facility, but we as citizens have also failed, and it's very, very clearly visible when channels like you portray this kind of vision. And it's not happening only in Mumbai, it's happening in Bangalore, it's happening in Delhi, it's happening in other megapolis also. So where we as citizens, why are we not taking care of our own self? That's a big question, and that's a big thing that's coming out on the show right now. And I'm absolutely harassed to see the kind of way the people are moving in and around containment zones, and there are misreporting of certain deaths and all. This is absolutely ridiculous. I would definitely want that on the show today we discuss, and please make it aware that all citizens, including all those viewers of Mirror Now, make it a point to fight the pandemic as an individual by staying home, by following the norm, by following social distancing.
No, I agree with you. People have a responsibility and they must, and which is why we are highlighting it. But Mahesh, is there something that the government can't do for implementation? Your civic body authority, your policemen on the ground, we start booking people who are violating norms. So for example, in Karnataka and Bengaluru, they have a high number of cases that have been registered against lockdown violators. Is that something that your government needs to look at now?
Tanvi, let me assure you that we have also booked cases against violators when the lockdown was extremely severe. In these 3 months of lockdown, we have educated the people to restrict their movement and go only when it's absolutely essential for them to go venture out, either for essential service or product. But we see that the moment the lockdown was rolled down and the unlocks one started, people have been coming out on roads, people have been going to the food area, the bazaars, and the pandemic does not seem to stop. So the question comes to my mind whether locking down the people for 3 months, did it help us, or whether the new surge that has come after the unlock one has started, is that a new threat that we are going to face in the coming monsoon?
Well, let me also bring in Dr. Srivastav at this point. Dr. Srivastav, this is going to be extremely difficult task if we don't follow the norms. Of course, we've unlocked, and it's a good thing that parts where there are lesser cases, people are able to step out, do the basic work. Some shops are open, but there is a danger of the cases now going up. In many parts of North Mumbai it's happening. Even in the outskirts in other districts from Thane to Kalyan, Dombivli, this is happening. Now, how do we ensure that lockdown is followed, that so many people actually follow a disciplined routine? Can we rope in, civil volunteers, NGOs? Who does this job?
So, Tanvi, first up, thanks for a terrific report on the ground reality. Very important points that you're making are very crucial, very important. Look, how do we ensure this? There are two things. Not everything that is a public health issue is going to be the responsibility of the government alone. There has got to be the individual responsibility, the community responsibility. In a different context, there is a term that I have read in a historical perspective of these situations, which is, the term is a benevolent dictatorship, right? These are times where you need to have the iron hand of an administrator who will be benevolent when it is required, but will need to speak the harsh word or do the harsh action if it is in the best interest of the community or the state or the country. I think that that's the kind of situation where we are. The lockdown was indeed a time of a lot of difficulty for a lot of people. Everyone accepts that. But the entire country went through the lockdown. And it has actually achieved the best part of its purpose was to save lives. And that has been in a large volume that has been achieved. But the subsequent period after the lockdown, I'm afraid, if this is how communities are going to behave, then unfortunately, you're going to have to take some harsh measures, because then all the gains of the lockdown you are going to lose in the next about 3 or 4 weeks, 6 weeks, 1 month. While we may have come to the plateau of the infection at this time, at least in a place like Maharashtra, or at least in Mumbai, may not be Maharashtra, but at least in Mumbai, it's not nowhere close to being out of our lives. And so it's still the responsibility of the individual and the society to make sure that it does not come to a situation that you have lost everything that you have gained in the last 8 to 10 weeks of lockdown. So it is a difficult situation, but some harsh decisions will need to be taken.
Yes, and that's what I'm trying to understand. How do you go about it? What are those hard decisions? So very quickly, before I let Mahesh TAPASE go and move on to the other big city, and we'll talk about Bengaluru and then Delhi. But Mahesh TAPASE, we understand that BMC is now struggling to find some of the patients whose addresses are either wrong, who've gone missing, are not reachable, so you don't know how to go about tracing further contacts. The people are not following rules. Are we seriously then looking at a situation where you may tighten the norms and start booking violators and put proper strict lockdown if people don't follow rules?
Tanvi, as far as the 70 COVID positive patients who have gone missing, the latest update I have is that the BMC has been asked to take the Mumbai police, and that's how they are going to do the contact tracing. I think they visited the houses of the patients, which is currently locked, and even the mobile numbers. So that's again, and like how Dr. Srivastav said, that it is also our responsibility as citizens. We can't be blaming the government, but yes, the government is doing whatever best is in the interest of the patients and the city. But there is a limited scope for the government also to play. So we all have to contribute to safeguard the city and its citizens and the state. And yes, as far as tightening the situation, there might be probability that if things go out of hand, or if the government feels that things are getting out of hand, then like Dr. Srivastav again said, a benevolent dictator might be there.
Okay, we have unfortunately a little bit of a bad line with you also, Mahesh TAPASE, but I understand what you're saying. In fact, I want to play out, the conversation we also had with the MOS Health before we move on to the other city. This is Rajendra Patil, the MOS for Health for Maharashtra, and one of our reporters who's been on ground, who's been looking at the situation and reporting on it, actually asked him this very question. For containment zones and even for non-containment zones where shops are open on both sides of the street. Remember in Maharashtra and Mumbai, they have specific rules about how many shops in an area, in what method should they open, but that's not being followed. Now in that case, the authorities will have to come down and should shut down these shops, should penalize the shopkeepers who are brazenly violating the norms and opening their shops. If people don't follow rules, maybe few of them need to be penalized and booked. And if we send a strong message, perhaps that would work. Viewers, we have to understand Mumbai is in a very, very tricky stage right now. Yes, it's not as bad as things were perhaps 2 weeks ago, but we are now not out of the woods and we cannot take that risk. Let's play out Rajendra Patil, the MOS Health for Maharashtra, before we go to the next city.
जिस एरिया में पेशेंट बढ़े उधर लॉकडाउन किया, अभी उधर का टेस्टिंग की संख्या जो है वो बढ़ा रहे, जो सेफ्टी मेजर्स करने के लिए लेने के लिए आते हैं वो सब कर रही है सरकार। अगर ऐसी ज़रूरत पड़ेगी तो लॉकडाउन किया जाएगा, जो मेजर्स सेफ्टी मेजर्स लेने की ज़रूरत है। लेकिन दूसरी बात भी है, एक है कि डबलिंग रेट जो है उसमें भी दिन बढ़ेगा अभी। इसलिए ऐसा नहीं है कि वो डबलिंग रेट वो लगातार बढ़ रहा है, ऐसा भी नहीं है। डबलिंग रेट में भी अंतर पड़ रहा है। जिधर ये लॉकडाउन का, और जब लॉकडाउन ख़त्म होने के बाद जो गलत इस्तेमाल जिधर होगा उधर फिर से लॉकडाउन करेंगे, ऐसा सीएम साहब ने बोला है पहले ही।
Let's move on to the city of Bengaluru, viewers. A city that reacted fast, very quickly in the initial days, did exhaustive contact tracing, ensured that people are quarantined, put out watchers there, asked the societies to ensure that those who are supposed to be in quarantine do that. Bengaluru was also the city that started to lift the restrictions first, and justifiably so, because they had few cases. But now, they seem to have completely forgotten what COVID is all about. So even though as of June 8th, from April, May, June, as of June 8th, Bengaluru had just 500 cases. Today, the city stands with 1400 cases. Yes, because there were more travelers coming in, internationally, domestic travelers who've come in, that could be a reason. That is a reason. But it's also how people are not following norms on the roads, on the streets, in your public transports, in your marketplaces. To the point that the Chief Minister held a news briefing, held an emergency meeting yesterday, and it was decided by the authorities that few of the key market areas, which are extremely crowded clusters in Bengaluru, will be shut down for 2 weeks. I don't know why they said that and why they announced that, because we went today to the same market and it was open just like any other day. Here's a report from Chickpet Market. Take a look.
On Monday, the Chief Minister of Karnataka, B.S. Yediyurappa, announced that several big market areas such as KR Market, Chickpet, Siddhapura, and also, other such areas, Kalasipalli as well, will have to be sealed down or will have to be locked down. But while we've seen it in one or two areas, there are still several such areas that are yet to see the implementation on ground. We're here, this is the Chickpet area that, you can see the big market, the big traders area, where, people, of course, have resumed life as normal. There is activity going on, shops are open, people are, in fact, thronging these markets. Clearly, of course, as you can see, there is no social distancing that's being maintained over here. And, there's, of course, no sort of authority in place over here to be enforcing this. So, while on one hand, yes, the number of cases in these areas particularly have been on a very steady rise, these areas have also emerged as the clusters. Now, the Chickpet area, of course, one which is a very, very large one at that. It is going to be a mammoth task for the authorities to, seal down these areas. But how they do it really is going to, be the challenge. Because remember that, Karnataka is now on the verge of, also a steady rise of cases. We're seeing that while, of course, the situation, is worse in other parts of the state, Karnataka was one of the first to actually open and allow the unlock in phases. They reaped the most benefits out of it. Almost all the commercial establishments were allowed to remain open, but now fearing that we may have to pay a costly price for that, areas are going to be sealed down again. Of course, again, like the government too has urged people to completely stay indoors unless necessary. In this market too, traders are going to be urged to shut shop and go home. In Bengaluru with video journalist Pradeep, this is Neha Hebale for Mirror Now.
Let me go across to Dr. LIPIKA Nanda and ask her this question. Dr. LIPIKA, how do we ensure that, the cities who would even manage to perhaps get a grip on this don't lose control, don't spiral out of control. The Delhi is in a mess right now, and day after day the cases are on the rise. Mumbai is not out of the woods, and Bengaluru seems to be going backwards. Dr. Nanda, that question to you. Dr. Nanda, are you able to hear me? Okay, we're just going to patch that line again with her. I have a bit of a trouble there connecting with her. But let me come back to you, Dr. Srivastav, because, Mumbai and Delhi, of course, have been the biggest challenges. Now, of course, a lot of it also depends on the amount of testing we are doing and cases that we are registering, and we are seeing some kind of slowdown in that as well. But let's again talk about the dangers of forgetting COVID, the dangers of coming out and acting as if life was normal.
Yes, absolutely, Tanvi. I think, look, if you simply look at the patterns of the infection the world over, a lot of countries that did very well in the first phase of the infection, a lot of countries where the numbers were in a few hundreds, by the time it came to, say, March end or April beginning, these countries were reporting 700-800 patients every day. We are probably going to go through a similar kind of a cycle, because we know that this is not a uniphasic virus. It's not one phase of the virus, and that the virus in itself is something that is going to find newer and newer ways of representing itself or coming back into the community. So the three things that we know that work and work very well is that you must have your social distancing. You must be able to ensure that your hands are clean, the surfaces that you touch are clean, and that you should be wearing a surgical mask or a face mask. We also know that if there were two infected people, if both of them were wearing a face mask, the chance of them passing infection onto the third person in their vicinity is going to be between 1 and 1.5 or maybe 2%. That's a very small number, and that should be kept in your mind, taken into cognizance. Because in fact, even if you are infected, you're an asymptomatic infected person, wearing the mask is going to ensure that you're not going to be passing the infection on. So it is not a time to be complacent. The fact that fewer people have succumbed to the infection in India should give us the faith that all that we have done so far is being correct and appropriate and well-timed, but that does not ensure that this is how it's going to remain. And so it is not yet over. It is not a time to be complacent and come out and say, look, I've done my 3 months of hard yards, and now it is my time to get back to business or work or play or whatever it is you think. This is a matter that should be in the mind of every Indian, whichever city or whichever village district you're living in. It's not as yet over. People should be cognizant of this and continue to take the same precautions until such time as we know that the virus has come to a natural end to its life cycle, which is not going to be happening for another few months at least, if not longer.
Oh yes, absolutely. And I think what is happening in Bengaluru is a classic example of that. While in Mumbai and Delhi, some of the areas still, always were problematic, and now more are popping up. Bengaluru was actually doing well. But now almost all kinds of shops are open. There is no social distancing that is being observed. People are roaming around freely. There's crowding at different places. And authorities are also not visible. Now, Dr. Nanda, the question then is, to what extent can the government, can the civic body officials or the police officials ensure that these rules are followed?
Well, I have been listening to your discussions since the beginning, and I find that sometimes when there is a mismatch between containment strategies and economic recovery goals, it leads to poor compliance. And just imagine, people have been in lockdown for the last several months. They also have to take care of their economic, kind of requirements. So you are right. The compliance is gone right now. So it is very important that the government starts working with communities. involving communities. When I'm saying involving communities, the local government, the community leaders, local influencers, the resident welfare associations, trade unions, the business associations. I think government has to start discussing and working with them to see how to bring a balance between the containment strategies and at the same time ensure that people's economic activities also can be carried out.
No, I agree with you, and our idea here is to not say that we should shut down the economic activities, but there are rules and norms that have to be followed, and how do we ensure that happens? Now, Mr. VAMAN Acharya of the BJP is joining us right now. Mr. Acharya, we are going city by city. The common thread there is that in each city, whether it's in containment zones or non-containment zones, rules are not being followed. Each of these cities, the cases are on the rise. Bengaluru is no different. Today a reporter went to Chickpet, which is a market we are told was supposed to be shut for 2 weeks, but it was open and everything seemed normal. Now, how do we ensure violations don't take place?
Actually, for Chickpet, what had happened is...
Yes, Mr. VAMAN Acharya.
It was a self-declared band that Chickpet people had declared. But unfortunately, it could not be implemented by them only. There were shops which were open and some market activity was going on. Now, people here have been following the laws, the instructions given by the government to a very large extent. But still, I agree, looking at the population we have, looking at the different needs people have, following it 100%, even governments, it is not possible to do. Governments keep on educating, trying to implement the laws, sometimes use police, sometimes corporation uses its own force, but still there are lacunas. But I find that in whole of the country, Karnataka's implementation of the law seems to be fairly good. The number of deaths here are quite less. Even the number of people who have been infected is less. But the number is rising. This has to be accepted because this is a global phenomena and this is happening especially with this corona disease in India because the numbers are increasing after this containment and bans and lockdowns are just released a little. It is not just because the lockdowns are released. That is the nature of that particular virus itself, COVID virus, because it keeps growing now. The growth phase is at its best now. Only good thing about Karnataka is the number of deaths is less, sufficient medical treatment and care and distancing, all these precautions have been taken. But I accept that the numbers are increasing even in Bangalore.
Yes. So my question then is, and I agree with you, and Mr. VAMAN Acharya, Bengaluru and Karnataka as a state were doing far better than all the other cities. Up till June 8th, Bengaluru only had 500 cases. Now suddenly we hit 1400 cases and there are more. At some point, something will have to be done. You've booked people, violators, you've taken action against them. That also doesn't seem to be working. Should the authorities then move ahead and start shutting down shops which are breaking rules, hotels that are breaking rules? Because our reporters tell us that hotels are also not following social distancing between tables. Even in shops, they're not following, social distancing norms. Buses are carrying more people than what is allowed. These are some things at least that can be in the control of the authorities.
I fully agree with you. Though I find that in hotels, there are practically no customers. Most of the hotel people are complaining that they don't have any collection in the whole day. Buses also same problem. BMTC, that is Bangalore Metropolitan Bus Service, is running at hardly less than 30 to 40% of its carrying capacities. So what is happening, it is not that the law is to be implemented. But still, with all these things, I find that the numbers are increasing. That is because of the inherent nature of that COVID virus itself. Though sufficient precaution is being taken, what best can be done, what containment can be done, what laws can be enforced, that Karnataka government is sincerely doing, and in whole of the country, Karnataka government, even PM Modi has accepted that is one of the best states where implementations have been fairly good. I don't say that it is 100% foolproof, but still in existing situations of our population, of the people, their economic situation, things are moving, and what you have suggested, we accept it. We'll see that better implementation efforts are done from today itself.
Okay. Mr. Acharya, before I thank you for joining us, very quickly, our reporters say that the decision to shut down these key markets, and Chickpet was one of them, I think there were 4 or 5 others also, to shut them down for 2 weeks was actually announced by the Revenue Minister. So isn't that a government decision? Can we really say people decided and now they're not really following it? So what's the solution then?
No, actually, Chickpet, that local merchants association has declared it's a market area that we will not open for next 14 days, but that did not come into action. Same was the case with KR market. Some people feel that we should open. Once they come and see that some 5-6 shops are open, others also will start opening. When they are open, why should we lose our business? This is a type of tendency that is happening in Bangalore, and it will be there everywhere also. We will try to implement it strictly. The order at Chickpet and Kapet were not by the government. They were by the people themselves, and the minister had requested. I agree. Because Revenue Minister R. Ashok.
Okay, thank you so much for joining us. Yes, exactly. Okay, all right. Thank you for that clarification. But I hope, Mr. VAMAN Acharya, that you and your government do what you're promising us. While it is the citizens' responsibility to follow the norms for their own good, at some point perhaps a nudge and some strict action will also be required by the government agencies if people are not following these rules. Thank you for joining us. Let's move to the big one. The big national capital, which is now fast turning into Corona capital of the country. Viewers, look at the difference. In Bengaluru, the number of cases have gone from 500 early this month to 1400. In the national capital, the number of cases have actually gone from 28,000 on June 8th to 62,000 yesterday. Very quickly, very quickly catching up with Mumbai, that stands with over 67,000 cases. On a daily basis, because of the fact now that testing has further gone up and has further been ramped up, 3,000, 4,000 cases are being registered. Why is it still that people of Delhi are not realizing just how big this challenge is? Why is it still that even in containment zones, people of Delhi are not following the rules? And what is it then that the Delhi government, the civic authorities and the police can really do? That's the big question. First up, take a look at this report we got from the Bada Hindu area, which has been under lockdown for a month now. But maybe people don't remember that.
We are reporting from Bada Hindu area. This is one of the areas which are under containment zone. Despite that, there are several norms are being flouted. Here, this is barricade, but despite that, the movement of the people is still going on. My video journalist Amil will show you that how the people are roaming freely here and there. No restriction for the movement of the people. Many people you will see without any masks as well. You can see there are many people are roaming on the streets without following the social distancing norms. Shops are also opened there. You can see one of the person is, after seeing our camera, just shutting his shop, and this way the whole process is going on. Definitely police presence is also not there. You can see that large number of people are over there on these streets. They are supposed to be at their home because this is containment zone. They are not allowed to move on the street. Despite that, they are moving freely here and there. Many people are not wearing masks, and these are the things which are essential in this particular area at the containment zone area. But despite that, people are not at all ready to maintain all these things, and this is the reason that at many places in the national capital which are already under containment zone, the people are not following the social distancing norms and the cases are rising daily. In fact, in this particular area, there are 30 cases have been reported so far. This lane from where we are reporting of the Bada Hindu Rao, and despite that, people are not at all ready to follow the norms of the social distancing. Here you can see there are people are standing outside their houses, outside their lanes, and walking freely here and there. There are people who are coming inside despite the barricades of the police. In fact, the police personnel are also not deployed over there. So this way the whole things are being flouted. Definitely that is raising the serious question on the measures that is being taken, that are supposed to be taken at the containment zone.
So let's also say good evening to Tanvi Shukla, founding member of the Aam Aadmi Party, who's joining us right now, and Mr. B.L. Vora from a DGP on what is it that the authorities can do for implementation of the lockdown and how it's become a huge challenge. But very quickly, I just want a quick comment from Dr. LIPIKA NANDA also on the national capital, Dr. Nanda, where cases are on the rise even now, crowded areas. To what extent can you control such a large population? Is there a role that the authorities can actually play by booking violators, by penalizing them?
Well, that is going to be a very difficult question to answer. And you cannot, when what we are seeing right now, there are hundreds and thousands of people that are outside just violating. How can you book so many people? I think our systems cannot support also so many people being booked within our system. But Tanvi, I would also want to touch upon another issue. When we are talking about this violation, we also need to talk about, our health system. This pandemic is ruthlessly testing the weakness of our health system. Health systems have not geared up to deal with this outbreak as of now. Now, the hospital infrastructure, for example, highly inadequate to deal with the daily cases, be it Delhi, be it Mumbai, and the doctors, medical staff inadequate. Hospitals are mostly run by junior doctors, and one sees signs of exhaustion in them. And we do not want to strengthen our existing health systems and want to, for example, you must be seeing in newspaper advertisements for filling up positions. Lot of health positions, medical positions and public health positions for years together have been vacant. So now we are thinking of strengthening our health systems during this pandemic. So it is quite late. But doesn't matter. I think it is very important right now to streamline the hospital operations with best managerial resources available within the country. We also need to streamline, the treatments. The other thing, apart from this is, how good are we doing on testing, tracing, isolation and treating? We probably are not doing a great job. And also cluster containment. How well, you are just seeing right now, cluster containment previously was being done by the help of multidisciplinary teams of police and medical personnel and administration. But now I think they have all gone back to business as usual. The other important thing, Tanvi, is that most corona cases can also be managed from home. Everyone need not be hospitalized. So better awareness programs on standardized patient care at home need to reach out to patients. And I think the media has a great role in making that.
I agree with you, Dr. Nanda. We've been repeatedly speaking about it. Yes, we've been repeatedly speaking about it, that the mild cases, people who don't have any other health conditions, should be staying at home. They don't need to go to the hospital. They don't need to be hospitalized. But what do you do when those people, instead of staying at home, start stepping out, go missing, go untraceable? You don't know where they are, if they're spreading the infection to more people. That has become the big challenge now. How do you trust people to stay at home? Now we've come to a situation where the Delhi government can't figure out a policy, whether to send everybody to an institutional quarantine or to put all the mild cases in, asymptomatic cases in home quarantine. If they are in home quarantine, do we need to go send somebody there to verify and check what's happening? How do we do that? We don't have so many people to do that. It's all becoming a big complicated issue simply because people are not willing to follow the rules and do their bit here in this war against corona. Ravi Srivastav, what's the solution? Delhi cannot afford this. The numbers that are being reported on a daily basis are actually worse than what even the government itself was projecting.
Thank you, Tanvi. First of all, a word of appreciation for your reporters who are doing painstakingly reports on such areas which are, almost containment zones. They're outside, they are reporting. They are putting themselves also to a lot of risk and all that. But let me tell you, given the situation, I think Arvind Kejriwal is trying his level best to manage it. He himself, his health minister, both have become the COVID victims. Not Kejriwal was not positive, of course, but then Satyendra Jain was struggling in the ICU for quite some time. They are doing a lot in that area, in that whole of Delhi. And unfortunately, today Delhi numbers have caught up with Mumbai numbers. It is really bad that people are not understanding that government has done the unlocking, but Corona has not done the unlocking. Corona will continue to spread. The more you expose yourself, the more that you will be exposed to these things. I think you have rightly said it. Delhi, 12,900 people are in home quarantine there. But still, if they move out, I think the government should take them with the iron hand. Some kind of firm action is required. The police presence is required on the road, on the containment zones where these blockades have been put, and no movement of the people like this should be allowed. People should be taken to task. Not necessarily everybody be arrested, but the police has got they have got a system by which they can warn people. And I think Mumbai, in some places, it has been already implemented and done. And the result is also visible. The Mumbai is reaching towards a kind of a plateau. We are not out of danger as yet, but things are improving. But as far as Delhi is concerned, you must have heard today also,
yes,
a 10,000-bed hospital, a place for COVID exclusively is being planned, where the ITBP personnel will be placed, and that will take care of, large number of rising cases. But I must say that administration and the police must play their role in keeping the people inside the houses. There are systems available. There are e-com deliveries. There are deliverables of vegetable, essentials. Everything is available. It is happening. But then still people move out. It is totally, unwarranted. And those people must be taken to task. Otherwise, we will not be able to control this pandemic the way.
Okay, let me bring in Mr. Vora and ask a former cop as well, a former top cop, on whether to what extent is it possible, Mr. Vora. In the initial days, we saw police was out there in large numbers, for any violators. If there were shopkeepers who were opening shops, those shutters were being downed, crowd control was taking place. People were being questioned on why they are out, and they were being sent back. There were barriers everywhere. Maybe, in some of our cities now, the police force is also exhausted. They've been doing this for over 3 months now. But isn't that required now more? Isn't that also the need of the hour? How do we ensure that people follow the rules?
You are absolutely right. See, police also is exhausted. Also now with the opening of the lockdown, normal policing functions have started. Crime has picked up. Police is busy with other things. And policemen are also being affected, and they also have to respect all the norms. And I know that they are doing their best as far as Delhi police is concerned. But yes, more needs to be done. Maybe they can recruit more home guards and civil defense personnel. But coming to the problem which you said, you're absolutely right. People do not respect these instructions at all. Social distancing, mask, spitting. I've seen people myself. I've seen so many people, they're just not bothered. Another thing which has added to the confusion is, the multiplicity of authorities in Delhi, which is peculiar to the city only. You have state government on the one side, Lieutenant Governor on the other side, Ministry of Home Affairs on the third side. Normal citizen of Delhi, let me tell you, I live here, Tanvi, that people are very fearful and they don't know what to do and where to go. Now people are feeling harassed. On the one hand, we are told that there are vacant beds. On the other hand, when people go to the hospitals, they are not allowed entry into the hospitals. They are asked to go away. Cremations, you must have come to your notice. There are lines. Somebody had to take the dead body of his near and dear one to 8 cremation grounds. So there's a total mismanagement on the part of the state government here as far as the Delhi state government is concerned. So I think everybody has to put its act together. Police, yes. People, yes. State government, yes. And I think there should be a lot of two things. One is aggressive messaging that please don't take your own lives. This is very, very important. And punishment should be swift and severe. I think some people should be jailed straight away, and a lot of publicity must be given to this kind of thing. Now, the last but important issue is the cost. No, we are told that this is very cheap. You can go to hospitals, but if you go to hospitals here, the private hospitals, they are charging hell of a lot of money. And though the government professes that go to the government hospitals, they themselves don't go. Delhi's health minister himself went to the Max hospital in Saket. So point is, well, of course, everybody's life is important. So I think there's a whole lot of things. And testing again now, they need more doctors, they need more facilities. I know for certain one of my relatives owns a hospital. Some nurses have resigned. They are fearful. They want PPE kits. They want more, at least money. And here are cases where Delhi government has not paid salaries to the doctors of a hospital for 2 months. So over and all, people are responsible. Definitely, they are not following the norms. But I think state government also has to put its act together, and that is where we are failing badly. And I think numbers are good.
Okay, no, I understand. But Mr. Vora, while that is a different part of a conversation and we've done that, I largely wanted to focus tonight on implementation of the rules and how that's becoming a challenge. One, we need to understand that this is as much important to us as it is to the government and the entire country and everybody else. And two, the governments have to find ways. If the police is tired and spent and exhausted, maybe we bring in additional police like you pointed out. In fact, Ravi, that's something that was actually done in Maharashtra. At one point, the Maharashtra government did ask the central government to send in additional forces to relieve our, and give some amount of break to the police in Mumbai.
Now, today, the Delhi government has asked for more doctors from the MHA. Now, today, I read they were asking for army doctors and paramilitary doctors. So, and aggressive messaging is needed on the media that please don't take your own lives, and swift punishment, quick punishment. But I think systems need to be streamlined. I'm sure it is not insurmountable after all.
Yes.
We have been able to
yes, well, Mr. Vora, you say aggressive messaging is needed. Let's hope more people watch this show that you are part of, because Mirror Now has been doing this every day. Every day we've been talking about what our responsibilities are and just how important it is that the coronavirus war isn't over. If I can just go back to Ravi Srivastav for closing comments before I wrap this up. Ravi, go ahead, please.
Yeah, just Tanvi, a couple of things I want to say. That first thing is this communication gaps are very important. Because something was coming from central government, it comes to state government, it comes to the municipality, it comes to the ward, it comes for the implementation part. And there were a lot of distortions in that. The definition of the containment zone, what will be the requirement for the containment zone, all these rules have been changing very rapidly. I expect a better kind of communication between these government departments so that a common man understands that what is prevailing. Here, after unlocking, this was expected that cases will definitely go up, but if they are going up exponentially or multiplying, then again a lockdown or stringent measures must be applied over there. The Delhi government is hard pressed because they have not got any money from the center, and that's
the strategy for all governments is to see that if in areas where unlocking has happened, if rules are not followed, social distancing isn't followed, cases spike, the governments have the freedom to bring in tougher norms. Tamil Nadu has done that in 5 different districts. But viewers, why do we want to go to such a stage? Why do we want restrictions and lockdown and shutdown of activity one more time? The rules are very simple. Follow the norms, reduce your outdoor activity as much as you can, keep your distance. If you're in a containment zone, follow the norms. So until the cases go down, coronavirus isn't going anywhere, but at least you and I can ensure that we reduce the number of cases and we get a grip on this battle. It's up to you and me and our governments and our policemen and of course our healthcare workers. Thank you for joining us on this conversation.